like to welcome you here today to this webinar on tobacco and COVID-19 that is being curated by the South African Medical Research Council. So today's webinar is part of a webinar series that's been run by the International Confederation of Alcohol, Tobacco and Other Drug Research Associations and the Department of Psychology at the University of Johannesburg. This webinar is being sponsored by the Society for the Study of Addiction. And in fact, this webinar series, the entire webinar series, which includes 6 separate webinars, is being sponsored by SSA. So we're most grateful to SSA for their contribution to this webinar series. Before we begin, I'd like to express our gratitude to a number of individuals who've made it possible for us to run this webinar. Firstly, my colleague in the Department of Psychology, Ms. Lebogang Ramalepe. She's the webinar coordinator. We thank her very much. Secondly, the team at the University of Johannesburg Library, headed by Ms. Palisa Tlatsi. She's done an excellent job. And thirdly, my colleagues and fellow members on the board of ICARA. We thank you all very much as well. So before we begin, I'd just like to clarify a few details about how we plan to run today's webinar. So firstly, just to remind you all that this webinar is being recorded and live streamed on Facebook. So by attending this webinar, you're giving permission to for the webinar to be recorded. Secondly, in terms of videos, please note that videos will be disenabled for participants. However, speakers will be able to switch on their videos when they're speaking. And then thirdly, if you would like to talk, if you'd like to ask questions, there's an opportunity for you to type your comments and questions in the Q&A. So this will be possible, and at the end of each of the presentations, you'll have a chance to ask questions. And then finally, we have one final request for you. At the end of the webinar, we have a poll. So you'll receive a poll sheet on the screen. This will pop up, and we'd ask you to please give us feedback on this poll sheet before you log out of the webinar. But apart from that, I'd just like to thank you all once again for having come and being able to join us today for this webinar. I'm sure it's going to be very, very interesting. We've got a fantastic lineup of speakers today, ladies and gentlemen. And so without further ado, I'd like to hand over now to Professor Niamh Fitzgerald. She's the president of ICARA, and she's going to be introducing to all of you ICARA, and she'll also introduce the hosts to this webinar. So we hope you enjoy yourself this afternoon, ladies and gentlemen, and thank you once again for joining us.
Thank you very much, Neo. I am just trying to find the right set of slides to share. Here we go. So it's a real pleasure to join you again today. This is the 3rd webinar in our series, as Neo said. My name is Niamh Fitzgerald. I'm a professor of alcohol policy and director of the Institute of Social Marketing and Health at the University of Stirling. And that's our lovely campus that we're missing at the moment as we're all working from home. That's behind me. And so you're very, very welcome to this webinar on COVID-19 and the tobacco, political and health economy. If you'd like to tweet during the webinar, you can use the hashtag ICARAwebinar. I'm just going to introduce the webinar with a little bit of background to ICARA. So we're the International Confederation of Alcohol, Tobacco and Other Drug Research Associations. We're an umbrella organization, relatively new, just 10 years old. And our members are mostly research organizations, associations, societies and teams across the globe that are focused, as you can imagine, on alcohol, tobacco and other drugs, but also behavioral addictions. Our mission is to promote, support and enhance research on these topics, both nationally and internationally. And the way that we do that is through professional exchange, collaboration and other activities. We have a strong focus on capacity building, so essentially thinking about peer-to-peer learning both within and between countries. As an international organization, we're non-governmental, we're multidisciplinary. We believe that it's important to have the input of lots of different disciplines in tackling the issues of alcohol, tobacco, other drugs and behavioral addictions. And we're therefore a civil society rather than a political organization. Our members are primarily organizational, although you can also join as an individual. And our current membership is quite international. So we have organizations focused on, for example, drug policy, addiction and the family, international addiction librarians, journal editors, and also several national associations in Europe and Australasia. We have previously had good membership also from North America and some from Asia, but it's been more difficult to keep our contacts going, particularly during the pandemic when we're not having face-to-face meetings. But really pleased that our international membership in particular has been expanding recently. So these are our members. I'm not expecting you to be able to read all of these, but I think it just gives you a flavor of the different opportunities that exist to reach out to colleagues across the world who are working on different aspects of alcohol, tobacco, and other drug research. If you'd like to know more or indeed contact any of these organizations, we have a member directory on our website where the websites of these organizations are there. You can link to those, but also a named contact for each one is there. You'll see also that we have associate members. So the associate members are not so much other research societies, but they tend to be just organizations that also want to reach out internationally. So some of them are research teams or university departments, and we very much welcome everyone as, all of the associate members as well. There's no difference in terms of the services that we provide to both full and associate members, except that full members have voting rights in our General Assembly. So what are the kind of benefits of membership of ICARA? Well, I suppose one of the main opportunities that we offer to all members is the access to a global audience. So we can distribute information about conferences or training initiatives, or whether it's if you're writing an advocacy letter, for example, to all of our members to cascade to their members, and therefore reaching a global audience. And I think we're all very tight for time at the moment, and so people may have a primary interest whereby they join. For example, I'm a member of an alcohol research association, but I'm also interested in cannabis policy. I'm interested in other aspects of other substance use, but I wouldn't necessarily myself become a member of those organizations. But it is useful through ICARA to be able to hear about events that are happening in other organizations. So that's one of our services. I suppose what we also feel very strongly is that across our member organizations, when we are often working with few resources as volunteers, just finding time to do this in our own time, there are often very common challenges and solutions. And so we focus on those in our own workshops, at other events, in this webinar series, trying to sort of bring people together from across different associations and topics. We are looking to have our own general meeting, which was postponed from last year, on emerging issues in cannabis and gambling research, probably in late September, early October this year, and that will now be online as well. So we also produce guidance, and the most recent guidance that we've produced is on managing relationships with commercial and other organizations where there's the potential for conflict of interest arising. So in that guidance, which is available on our website, we don't tell our member organizations how to handle these issues or what's right or wrong. It's really guidance to help them develop their own policies on how they might handle the issues. So to consider and reflect on the issues and work out a policy for interaction that is right for each of our members. I suppose fundamentally what we believe in ICARA is the value of bringing researchers together to discuss and share their values and interests. And so if you already have a network or research association that you're part of, where you can meet and get to know and share work with colleagues in your country with similar interests, would encourage you to consider if they would benefit from being a member of ICARA. If you don't already have that, however, one of our focuses is recognizing that not all countries have that and not everybody has that opportunity. So we would also encourage you to get in touch, even if you are as an individual feeling that there aren't necessarily opportunities for you to get together in your country or your region, or indeed on your particular topic, with others with similar interests. And we're looking at how we can pair up well-established research associations with individuals or small groups of researchers who might be trying to establish new networks. And particularly that may apply in low and middle income countries. So this is the ICARA board. We are having a little extra year in our term of office, which should have finished in 2020, but will now finish in the autumn, and very much welcome our colleagues who are at the webinar today. So I know that Mate is tweeting for us, and obviously you've met Neo already. So we are looking for new board members. As I said, our term of office will finish in the autumn. And so if you do share our enthusiasm on the value of connecting researchers nationally and internationally, and you'd like to get involved with ICARA, and also to grow your own network and your own profile internationally, then it's a fantastic opportunity. So please do consider having a chat with us as to learn more about what you might do if you were to join our board. You don't need to be a member of an ICARA organization already. The board members are elected, so we would encourage you to get involved if you're eligible to be a member of one, but that's not a requirement. And we very much welcome people who are earlier in their careers. And if you don't feel ready for a full membership of the board at this point, there's also an opportunity to become a shadow member, to shadow more senior board members in their roles. So please do contact me if you're interested, and those elections will take place at our General Assembly in the autumn. So just to briefly mention the other webinars that are coming in the webinar series. So the next one on the 17th of June is curated by our member, the International Society for the Study of Drug Policy, and focuses on cannabis markets, use and policy. And you can sign up for all our webinars, as you hopefully have already done, through the link on our website. You won't see full information on webinars 5 and 6 on the website yet, but just to give you a little bit of advance notice as to what they're likely to focus on. The 5th one, which may go ahead in July, we're in discussions at the moment with colleagues in South America and the Caribbean, is likely to have a focus on addiction issues in those regions. And COVID-19 obviously being the thread that runs through all of them. And then I'm working with Claire Wilkinson at the University of Sydney to look at dates in September for a webinar focused specifically on COVID-19 and alcohol policy. You will also be able to access the webinars that we've already had, so on substance use and gambling during COVID-19, particular experiences from Finland, and our introductory webinar, which was Pandemic Perspectives, Addiction Science in the Era of COVID-19. And those recordings will be uploaded shortly to our website. So if you keep an eye on that, we'll also tweet when they become available. So lastly, I just wanted to thank everybody who's been involved in putting today together. So particular thanks to our chairs, Catherine and Rachel, to all our speakers, and a special thanks to our University of Johannesburg colleagues, to Neo, and to Lebrang, Palesa, Hester, Theodora, and Cabello, who have been very patient with us. We are not professionals at putting webinar series together, and they have been extremely patient in terms of supporting us through this process. And so we're very grateful for that. As I said, if you'd like any further information, we have our website there, and you can also follow us on Twitter. So I wish you absolutely all the best for this really interesting webinar, and I'll hand you back over to your chairs now.
Thanks very much, Neem, and thanks, Neo. So I want to welcome you once again to this webinar, and I will be chairing together with Rachel. I am Catherine Egbe, and I work with the Alcohol, Tobacco, and Other Drug Research Unit at the South African Medical Research Council. Rachel, who is also going to be one of the speakers, is a research fellow at the Institute of Social Marketing and Health at the University of Stirling in the UK. We know that the SARS-CoV-2 virus has been, having a devastating impact on virtually all facets of life and living, ranging from economic to health, to education, family life, and general well-being. The COVID-19 pandemic has not only become a health issue, but a political issue as well. As I often say to my friends, SARS-CoV-2 has become a political virus, given the impact it has had on politics and politicking. This webinar, titled COVID-19 and the Tobacco Political and Health Economy, aims to explore how the COVID-19 pandemic has impacted on tobacco political and health economy generally. But we'll be taking case studies from South Africa and the UK. With the coming into force of the WHO Framework Convention on Tobacco Control in 2005, there has been quite significant achievements in tobacco control around the world. The WHO FCTC placed tobacco control on the priority action list of governments to take action that would save lives. Most governments have actually taken actions. They've taken steps to put in place WHO FCTC compliance legislations to control the use of tobacco and break the trend of the tobacco epidemic as a way to safeguard the lives of their population. But from the pandemic being used as a marketing strategy to bypass national laws, and to the use of the pandemic as a marketing and lobbying tool by the tobacco industry, we would say that the tobacco field or tobacco control in general has been uniquely impacted by the COVID-19 pandemic. And so we decided to put together this webinar where we'll be rubbing minds with very special experts from different parts of the world. And I will want to introduce the first speaker in order to save our time. And I will introduce Professor Ayo-Yuusf Lekan. Professor Ayo-Yuusf is the DVC Research, Innovation and Postgraduate Studies, Sefako Makgatho Health Sciences University, Pretoria, South Africa. He will be talking to us about tobacco and COVID-19, whether strong legislations would make a difference. Professor Ayo-Yuusf has had over 20 years experience in tobacco control. He has broad background in public health and has carried out longitudinal studies on tobacco use, particularly in Africa, in South Africa. His work has been critical in the South African government amending its tobacco control laws, including the regulation of smokeless tobacco products. His research interests include tobacco social and corporate determinants of health, including tobacco industry monitoring, smoking cessation, epidemiology of tobacco, and novel products use. Lekan has been involved in several tobacco control capacity building research programs on the African continent. And for 10 years, he was a visiting scientist to the Harvard School of Public Health Center for Global Tobacco Control Research. He has authored or co-authored over 100 publications in high-impact journals and trained several practitioners and supervised both master's and PhD students. He has worked with several international organizations as a consultant, including the American Cancer Society. In addition to being on the WHO's Tobacco Regulatory Study Group, that's the TOBREC group, he provides editorial expertise for several high-profile tobacco journals, including Tobacco Control. We welcome Professor Ayo-Yuusf. Thank you.
Thank you. Thank you very much. I will go straight to my presentation. I've been asked to talk to the topic on COVID-19 and tobacco control. In particular, the question, could strong tobacco legislation make a difference? In my presentation, gives a little twist to that, to the extent that we've already had COVID-19, or for the most part, and looking forward to what we've learned, or what experience we've learned, and how we could strengthen tobacco legislation and tobacco policy in South Africa and lower middle income countries in general. So indeed, in normal times, industry would continue to market and sell their product, but it looks like during the COVID period was no different. It became clear that despite the global burden of disease, the tobacco industry continued to sell this product, and the COVID-19, in spite of the evidence that COVID-19 is also one of those diseases that could increase, the risk could increase as a result of tobacco use. Since early days of the epidemic, there was evidence to suggest that this is transmitted through aerosols and likely transmitted through exhaling respiratory droplets while exhaling your tobacco, or spitting or sneezing in the context of snuff use in South Africa, which is often used through nasal application. And of course, sharing of mouthpieces through the use of water pipe. There was a lot of talk around the Zoll and sharing of cigarettes. Perhaps more common and less talked about is the sharing of mouthpieces of water pipe as a potential route for transmitting the COVID virus. So government generally on this basis took some decisions to introduce restrictions and regulate the availability of tobacco products. We often talk about precautionary principle, even when there's not overwhelming evidence that while you're trying to gather evidence. So this move by governments actually express or shows that there's some political capital built to actually strengthen tobacco legislation, particularly in countries like South Africa, India, and Botswana, that implemented the temporary ban on the sale of tobacco and nicotine products during a hard lockdown, because they considered tobacco products not essential product. Like I said earlier, irrespective of how effective these measures were, there were certainly lessons that were learned with regards to the opportunities to strengthen tobacco control policies in low and middle income countries in general, and in South Africa in particular. In understanding those opportunities, I've decided to capture them within the context of the empire, which are key policies that we know has been tested and have been known to be effective. So these lessons learned on how strong legislation could also make a difference would be what I would then be talking about in a couple of minutes, and the next coming minutes. So the first is the M part, which is the monitor, monitoring tobacco use and the burden. We saw how useful it was to be able to put together, or if you have the infrastructure for research to gather local evidence and to be able to put together evidence, how that can easily be used to support decision making. This study, a meta-analysis on smoking and severity of COVID-19 clearly shows that almost smoking almost doubles the risk for severe COVID-19. Further studies have shown, I mean, you can see the volume of studies all happened between 2020 and published in 2020. Shows there is potential to wrap up capacity for research and create infrastructure, and it is hoped that some of this infrastructure created, many in the low and medium income countries, can then be used to strengthen tobacco legislation by generating locally relevant data to support policy. The other M, the monitoring part, would be monitoring tobacco industry interference. It is clear that it was clearer during COVID pandemic that the tobacco industry has not changed its tactics. A number of these tactics, as you have them here, were used by the industry during the pandemic. A few are worth highlighting in order for us to better understand how stronger tobacco legislation could make a difference. Legal intimidation, that was quite strong in South Africa. Once the government took the decision to put a temporary ban, the industry ran to court. I'm not going to go into the detail. There were two different court cases, but the important thing here is the opportunity to also invoke the obligation to international treaty by South Africa. That's been used in the past. But importantly also here is that this created an opportunity to put together experts that could support future legislative processes as scientific experts to support government in terms of putting together affidavits to defend against tobacco industry intimidation. Another tactic here is manipulating science. Some of this information found their way into affidavits and court papers that were prepared in opposing government's case. This particular one has been retracted not only because of the problems with the analysis, but because of non-disclosure of industry link So government needs to be sensitive and aware in producing strong legislation to be wary of this type of tactics used by tobacco industry, because oftentimes they walk to the government or to the ministry with supposed evidence. This is another one, and I think what is important to note here is that once this paper was released, there was a big jump. So in addition to the science, there was also a lot of corporate social responsibility publication, like PMI donating 50 ventilators in a hospital. Also in Nigeria, Bangladesh, so low and middle income countries. And of course, the publication that they participate in vaccine development. As you see from this sentiment analysis, those publications began to reduce the negativity of COVID and smoking. It went quite low at about March, and you could see as it started moving with some of the publications that tobacco actually protects you from getting COVID-19. The other opportunity that the COVID presented to us was making us understand the importance of protecting the population from secondhand smoke exposure. This data shows that almost half of non-smoking South Africans are exposed to secondhand smoke, particularly at home. It's relevant now because most people are now working from home, and there's already studies that have shown that once you have this public acceptance that exposing others to secondhand smoke is not good for their health, people voluntarily introduce the rule to have restrictions at home as well. So I think the opportunity for advocating for the new bill to strengthen the current policy that allows for permissiveness of smoking areas is also highlighted during the COVID-19 pandemic. The offer for help, the old part of the empire, it was quite clear that there was quite a strong motivation for smokers to quit. Not only in LMIC, like in Bangladesh, the studies have shown that there was strong motivation for smokers to quit in South Africa and also in Britain. This particular data suggesting 440,000 smokers tried to quit during the pandemic. And almost nearly 1/3 of tobacco users reported reduction of their tobacco use in India. Similarly in Turkey. But the question then is, we also know that Article 14 is one of those policies that have not been well implemented in many countries, particularly in LMIC. And therefore, most of the smokers who were trying to quit during COVID period most likely did not get any support. And as you can see, the most common reason why smokers find it difficult to quit is that they just feel it's very hard. This is a demonstration of just calling for help. The study in South Africa also showed that 67% of those who tried to quit were unsuccessful. Again, it's likely that they didn't get help. So the opportunity here is to strengthen the old part of the policy by strengthening cessation programs, including our national quit line, and of course, considering introducing tobacco levies to support such programs, because you need resources to clearly support this program. So there is indeed such policy could make a big difference. One thing about tobacco, active smoking and obviously history of any smoking is being associated with COVID. And in the UK, 41% of those who quit said it was in direct response to coronavirus. I mean, that's a large number. So again, there's an opportunity to push the current bill to ensure we introduce the graphic warning label in order to move away from the current text only, because this could obviously have made a big difference, particularly in South Africa. They had the hard lockdown with temporary ban of tobacco products. Enforcing the ban on taps, particular sponsorship. This slide shows that there's a very strong support in sub-Saharan African countries. This was a study published in 2016, as high as 94%. And as you can see, Malawi is no surprise. Malawi and Zimbabwe at that time, and Eritrea, they were not signatories to the FCTC, WFCTC. I must say support in South Africa was much lower compared to other countries in West Africa, for example. So, but nonetheless, the majority of these school personnel, who are quite important members of communities and influencers, seem to support the ban of sponsorship. This study also showed that where people do not support, for example, there was the chances of reporting support for smoke-free policies in public places was 5% lower among school personnel who believe tobacco industry should be allowed to sponsor school events. It was even 11% lower among those who believe that tobacco companies should be allowed to sponsor school events as compared to those who don't believe they should. And more importantly, when this personnel believe tobacco industry encourages youth to use tobacco, there was 27% higher support among those who believe industry encourages youth. So therefore, the opportunity here to strengthen the TAPs is to ensure that there's a public attention to industry tactics on recruiting youth to smoke. So therefore, we also see an opportunity to strengthen that piece of legislation and close all loopholes in terms of sponsorship. Finally, in terms of illicit trading, of course, in South Africa, one of the biggest challenge with the ban was the fact that 93% of those smokers continued to get cigarettes, despite the lockdown at a very high price. They're probably getting this from existing illicit channels that were there before COVID-19, even though the impression is created that it seems like these illicit channels were only started because of COVID-19 pandemic. But importantly, what is important is the fact that we do have a problem of illicit trading, and there's needs for implementation of price and tax measures as mandated in Article 6. And we should also consider becoming the party to signing the protocol on eliminating illicit trade. But I think what is important that the government has actually taken a step from that lesson learned to have a significant increase in tobacco taxes in South Africa. And I think I'm hoping that's the beginning to strengthen that part of tobacco legislation, tobacco control legislation. In conclusion, the lessons from COVID-19 provides an opportunity to strengthen tobacco control legislation in low and middle income countries, supported by locally generated data. And I'm hoping that the infrastructure that has been built and the pool of expertise that come together around this time would continue to support legislation, pushing for strong legislation. And we can build on the political capital that was created by government taking that move to place temporary ban on tobacco products. The events also highlights the need to monitor and ensure implementation of Article 5.3, particularly all the guidelines that have been provided for Article 5.3, including having a code of conduct on how government officials interact with tobacco industry. And of course, as we have seen, there's opportunity to strengthen the enactment and enforcement of smoke-free policy, strengthen our cessation programs by considering levies to actually support and financially support structured cessation program, including the quit line. Introducing plain packaging and graphical warnings would have made a big difference, as we can see from the data presented from the UK. And of course, signing the the protocol on eliminating illicit trade. And finally, it was clear that coordinated response at country level made a big difference. But also ensuring that there's regional cooperation and building media relation in terms of what showing off what industry or how industry interferes with legislation. Thank you, and I'm happy to take questions.
Thank you so much, Professor Ayo-Yuusf, for that fascinating presentation. And I know that we have some questions for you. It's possibly no surprise that the tobacco industry hasn't changed its tactics during the COVID-19 epidemic, but I thought that you introduced very neatly the potential ways in which policies could be strengthened in South Africa and in low and middle income countries in general. So for example, by introducing plain packaging, highlighting the need to monitor and ensure implementation of the FCTC Article 5.3. You mentioned also about opportunities to strengthen cessation programs and tobacco advertising and promotion initiatives, and closing loopholes also around sponsorship and raising taxes too. So I wanted just to move to we've been encouraging you to type in any questions that you have in the Q&A function here. And we do have a question here for you from Joash Daniel, who's asked, how do we validate or counter tobacco industry manipulation to the public via public channels? So for example, social channels. So the tobacco industry invests in paid public communication to gain and distribute mass adoption of positive tobacco myths during COVID-19. And Joash is asking, how do we package truth, research and science to the public for understanding and fact? So I wondered, Professor Ayo-Yuusf, if you have any thoughts on that.
Yeah, we've always talked about knowledge brokers whenever we write science. It's such a distance from the public. They never understand what we put in the p-value. So we always need the knowledge brokers in order for science to reach policy which require public support. So this is why in my concluding statement on that slide, I highlighted the need to actually forge relationship with media because they become the knowledge brokers to allow the information to get to public. More importantly, the scientists needs to be aware as well on disseminating the science in a very easy, digestible way, such as fact sheets or policy brief for policymakers, infographics, placing them on digital platforms and social media. We also need to reverse engineer exactly what the industry does, but we need to make sure that we're on the right side of the equation in any case. So I have no doubt that we'll get more people to make sure that we're able to get the word out there to the public.
Thank you. We have another question here from Catherine, and she's asked, how can governments differentiate between faulty science and genuine science, since we need them to use research publications and evidence to guide policy?
I think the response to that was part of the statement I made earlier on in terms of getting knowledge brokers for government and having to digest the science, the genuine scientific information, and putting out there, we really can't do this at the time when there's COVID, for example, but you need to do this and build this relationship with government, with media long before, and demonstrating why they could not trust tobacco industry science. There's evidence over years of the tactics of manipulating science. Once you are able to present that long before then, you become more credible and allow government to understand that it actually could be at least they could make up their mind. The same thing for the general public. We need to put it out there that tobacco industry has had these tactics. The playbook has remained the same. They just draw from the same playbook. The blueprint is the same.
Thank you, Lekan. We have a comment here from Corne as well, who says, in addition, that their experience is that journalists are quite happy to report on pro-health research and that it takes time to develop the networks and build credibility as well.
I agree.
Great. I'm just trying to have a look here and see. I don't think that we have any other questions submitted just here. So unless anybody else would like to raise any questions now, we do have a general discussion section towards the end of the webinar. Just check and see if there's any questions from the panel as well. I think that's all of the questions covered. So thank you very much for that enlightening presentation. I'm going to hand back over to Catherine just now. Oh, there is a new question, sorry. Let's see, there's a new question. Yes, so we have a question here, and apologies if I pronounce your name incorrectly, from Sebenzil Nikosi, who says the problem of illicit trade is a huge stumbling block and it links to a widespread problem of corruption in the country. Any ideas on how illicit trade should be tackled?
Well, you've correctly aligned the problem to a bigger problem of corruption. So the bigger environment of corruption needs to be tackled. Perhaps there are more experts on this platform than I am on tackling illicit trade. Corne, I'm sure you'll be happy to add to that. But generally speaking, we've always said it's about government taking the political will, having the political will to actually address it by enforcing law. It's pure criminality. Illicit trade is just simple criminality. You know, we know who the law enforcement agents often know who are involved in this. They don't do this in a spirit. They actually do it as you know, driving through the borders, or actually, you know, round tripping products. So it's all a matter of political will.
Okay, and can I just invite Corne? I wondered if you have any response to that at all that you'd like to share.
Yeah, thanks very much, Rachel. And I think that question is a particularly relevant one. It's a very, very multi-dimensional question, but I think if we can just look at it at its sort of core issue, I think Lekan is quite right in pointing out that it's very much a criminal issue. South Africa, unfortunately, has got a lot of corruption at very, very high levels. A good start for reducing illicit trade in tobacco would be to ratify the illicit trade protocol, or the protocol to eliminate the illicit trade in tobacco products. That's the formal name. So South Africa has actually signed it. It's been ratified by something like 60 or 70 countries around the world. And for reasons that are not clear to me, we have not ratified that treaty. Once we've ratified the treaty, you are able to get a whole lot of, let's call it, support from the FCTC Secretariat, from other countries, to implement strategies that would be able to curb it. For instance, licensing requirements, track and tracing strategies that you can implement. And some countries, even in Africa, countries like Kenya, countries in South America like Brazil and in Turkey, they have implemented track and trace strategies that, from everything that we hear, have been particularly successful in curbing illicit trade. So that would be an example of how to do that. I asked the chairman of the Portfolio Committee on Finance, why have we not ratified? And it was a question that was sort of, it seems to be lying on the ground. The ITP is a whole of government type of approach. And what that means is that not just the Department of Health, not just the Treasury, not just so the South African Revenue Services signs on to this thing. everybody has to sign up on it, and it seems that that will to coordinate that attempt is not there.
Thank you, Corne. Does anybody else have anything that they'd like to add at this point before we move on? Just double check we've got one more question, I think, from Peter Uko, who says that South Africa must also ratify Article 5.3 on industry interference and then enforce it and ensure that the number of meetings is minimized, and that when government meets with industry, there is always a TC group or people attending and that minutes are published. I think that's a really, really good point to end on there. Peter, thank you. On that basis, Catherine, will we move on to the next?
Thank you very much, Rachel. Thanks very much, Professor Ayo-Yuusf, for that very exciting presentation. We'll now welcome Rachel back. Rachel will be presenting on changes in smoking and smoking behavior in homes during COVID-19, a UK qualitative study. Dr. Rachel O'Donnell is a research fellow at the Institute for Social Marketing and Health at the University of Stirling. After completing her first degree in psychology and her PhD on quality of life and neurological disability at the University of Roehampton, London, Rachel then moved to Edinburgh and worked as a research fellow at the Department of Psychiatry, University of Edinburgh. Over the past 17 years, Rachel has worked extensively in tobacco control policy and research functions and moved back into academia in November 2015. Rachel is a qualitative researcher, and she has research expertise relating to the development of health behavior change interventions and research with individuals living in disadvantaged settings. Our current research focuses on the development of interventions to better support families to create smoke-free homes, alcohol licensing, and alcohol availability. Thank you, Rachel, and over to you.
Thank you so much, Catherine. So I'm going to present today some new qualitative research findings that we've literally just written up for publication. This title of the study is from one of our illustrative quotes. I was smoking a lot more during lockdown because I can. So we're really looking at how UK smokers have responded to the COVID-19 lockdown in terms of changes in smoking, but also in terms of changes in smoking behaviour in the home. So just to acknowledge the rest of the team that I've worked with on this study, Douglas Eady, Martin Stead, Sean Semple and Rory Dobson, all also from the Institute for Social Marketing and Health. This work was carried out in conjunction with the Public Health Policy Unit and was funded by NIHR Policy Research Programme. So a small amount of background to the study. Over the last year or so, there's an emerging consensus in the international evidence to suggest that some smokers have increased their daily tobacco use during lockdown. And this is often reported as a mechanism to deal with pandemic-related loneliness, anxiety, boredom, and/or stress. But it's definitely not a straightforward picture, because sometimes in the same studies even, other smokers report no changes in self-reported smoking rates, and there have also been studies reporting reduced smoking consumption as well. What we know less about over the last year is around smoking in the home and how the pandemic and associated lockdown restrictions have changed smoking in the home. And that's important given that the stay-at-home restrictions associated with our lockdowns. So there are a couple of recent studies conducted in Italy and Israel, which suggest really negligible increases in secondhand smoke exposure in the home during the pandemic. But that's in contrast to UK data from last year, which suggested that 12% of smokers living with children reported smoking indoors more than they did before the first lockdown. So just for context, the UK government introduced our first lockdown between the 26th of March and the 9th of May in 2020, slightly different timescales for Northern Ireland, but only slightly. And during this time, the key public health message was to stay at home, very loud and clear, with limited exceptions, including to go out for basic food shopping, to exercise for 1 hour a day, and so on. Now, an important context and backdrop to this is that in Great Britain, 1 in 8 households has no access to private or shared garden space or a patio or balcony. And we know from previous literature that this in itself is a key barrier to creating or maintaining a smoke-free home. And we also know that lack of access to outdoor space is associated with inequality as well. So those living in poorer areas in the UK are less likely to have access to outdoor space than those living in affluent areas. And you get the same patterning with creating a smoke-free home as well. It's by far now an issue of inequalities. And this is why we were keen to see how COVID-19 lockdown stay-at-home restrictions affected daily smoking routines and behaviours, and to investigate changes to pre-established smoking restrictions in the home. And very, very briefly, this qualitative work is part of a larger study which our team has been doing to look at indoor air pollution more generally during the pandemic. So there's evidence to suggest that changes in lifestyle behaviours imposed by lockdown modified outdoor pollution, but we know very little about modifications to indoor pollution during lockdown restrictions. And so the wider study is looking specifically at that so that we can gain a better understanding of the pandemic and its impacts on public health, and to support future pollution reduction policies as well. So very briefly, our sample, for the qualitative aspect of this study, we worked with an independent UK-wide research market research panel. And so we had access to just over 11,000 individuals living in the UK who has signed up to be panel members. And we invited all of those aged 21 or over to take part in the qualitative interviews by email. Now, because we were really keen to look at changes in routine associated with lockdown, we had some exclusion criteria which we thought would impact on that. So, for example, moving house recently, being hospitalised with COVID-19, or having a household member who was hospitalised with COVID-19. And from that initial pool of over 11,000 participants, we had 572 responders who were identified as eligible to take part, and 32 of them were recruited in order of response to meet a quota sampling strategy based on the various variables that are listed there. In terms of data collection, my colleague Douglas Eady and I conducted semi-structured telephone interviews with adults living in the UK between September and November 2020. So that's 19 to 27 weeks before the first full lockdown. Our interview questions were designed to elicit quite fluid responses around how people had spent their time before, during and after lockdown, and also whether and how their smoking behaviour and the behaviour of others in the household was affected by lockdown. All the interviews were digitally recorded, lasted approximately 60 minutes, and participants were offered a £30 e-voucher as a gesture of thanks for taking part. Douglas and I then led on reflexive thematic analysis using NVivo 12 with input from the wider team to identify patterns and differences across the data. Now, this slide here just outlines the sample characteristics of the smoking households who took part in the qualitative interviews. So I'm going to be presenting data just from the smoking households, which were 25 in total. I don't think there's probably time to go through this slide in depth, but we managed to meet our sort of quota sampling criteria in almost all aspects. In terms of our findings, firstly, what we found was that the amount of time spent at home across any 24-hour day increased quite substantially during the first full lockdown, as we would anticipate. So on average by 5.5 hours a day. In our sample of 25 respondents, approximately 75% described a change in their smoking levels during or following full lockdown. And in nearly 50% of cases, participants reported that the smoking increased. So in just under 25% of cases, participants reported smoking less during lockdown. And from participants' qualitative accounts of how changes brought about by lockdown affected their own smoking behaviour, we found 4 common themes in the data, which I'll discuss in a little bit more detail now. So the first was changes in routine and boredom. The second was confinement and stress. The third was smoking concealment. And the fourth was diversionary activity. And we found that these 4 themes reflected both possible influences on smoking behaviour, but also reflected ways in which smoking behaviour had changed. So in the spirit of qualitative research, I have some quotes here. I may not have time to read them all out, but you can certainly read them on the slides on the right-hand side here. So for our first theme, changes in boredom and routine, in our data, we found that individuals who were furloughed, so were temporarily laid off from work, those who felt they had a restricted social life and difficulties establishing new routines, led to boredom and listlessness, which in some cases contributed to increased smoking. But we also found in some cases that working from home in itself led to increased smoking, and in some cases to displacement of smoking in the homes. And that's illustrated by this quote on the right-hand side here from a participant who says at work, they don't like it if you go out every 10 minutes to smoke. It's a bit rude. She talks about how she'd start work at 8 when she was working in the workplace, and how she'd go out twice in the morning and then once in the evening, whereas at home, she says, I could be lighting up a cigarette every 10 minutes or so. So you can see from this quote how the fact that there are no longer workplace smoking restrictions in place, in this case, led to increased smoking in the home. We also found that participants maintained social relationships by meeting friends remotely or outdoors, and in some cases, this also led to increased smoking. Our second key theme was confinement and stress. And what we found in our data was that loss of freedom and stress associated with staying at home often increased smoking rates. And this was particularly the case in our data amongst those who lived with children and had limited access to outdoor space. And that's demonstrated by this first quote here on the right-hand side, where our participant says that at first during lockdown, they saw this as an opportunity to cut down, but then as the situation progressed and lockdown continued, it actually became more stressful being at home, which made this participant want to smoke more. And she comments as well on how the children noticed her smoking, and she'd get comments from them along those lines. In some cases, the pressures of home-based childcare and lack of access to outdoor space and work-related stresses as well also led to the relaxation of home smoking rules. So where rules had been in place pre-lockdown, those rules were lessened in some way to accommodate new daily routines associated with being home-based so much of the time. This wasn't always the case, and there's in one instance, for example, not being at work and being furloughed, being laid off from work temporarily provided an opportunity to spend more family time together, which was associated with reduced smoking. So that just demonstrates that there are differences in the data as well as commonalities. In terms of our third theme, smoking concealment, we noticed in our data that lockdown was often associated with attempts to conceal smoking from other family members, especially for those with no access to private outdoor space who weren't able to, for example, go out into the garden to have a cigarette. And in some cases, as is demonstrated by the quote on the right-hand side, non-adherence to existing smoke-free home rules could lead to tensions and to conflicts as well. So the participant here on the right-hand side talks of her husband going into the bathroom to open the window and have a cigarette. And he was trying to make excuses for being in there, but she says it was very clear that he was going in there to have a cigarette. In some cases, parents also sought to hide smoking from their younger children, so they didn't want their children to see them as a smoker. And in one case, this led to reduced smoking consumption as a result. And there were a couple of cases in our data where lockdown was instrumental in actually revealing teenagers' smoking habits to parents. So in a couple of cases, parents hadn't been aware that their children smoked, and lockdown, because it was more difficult for teenagers to conceal their habit, it started conversations about their nicotine use, and it was also more difficult for them to access tobacco. Our final theme is on diversionary activities, and what we did find was a number of participants who talked about activities including gardening and home improvement projects, which were a means of keeping busy during lockdown when there was very little that we could all do. And this was sometimes associated with reduced smoking. And one of the things we did find in the data, which we also find in the smoke-free homes data, is that decorating areas of homes often led to changes in home smoking rules because people didn't want newly decorated spaces to become filled with smoke. So that acted as a lever to creating smoke-free homes where they hadn't previously been. In terms of the implications of our findings, in several cases, the constraints of lockdown contributed to increased smoking. And I think that these findings highlight the importance of continued public health messaging as we begin to emerge from the pandemic. So these messaging strategies, for example, could emphasize how disruption caused by lockdown and other life changes, such as hospitalization or changes in employment, can present opportunities for smoking behavior change. I think that health improvement messages should encourage consideration of how smoking's changed during lockdown, and for those who have made positive changes, the potential benefits in sustaining those changes in the longer term. I think there's also an issue from our data in terms of any transition from COVID-related norms to new home working practices. And we've seen even in recent weeks, a number of big multinational companies talking about the likelihood that home working will become more of a norm moving forward. And that raises concerns for us in terms of the issue of secondhand smoke in the home, the absence of any sort of work-related non-smoking rules, obviously, in the home, and how that's tackled. And I think it's an area that requires further attention moving forward. So just to finish the work, as I said, it feeds into the other part of this wider project, which is estimating changes in indoor air pollution that people were exposed to during lockdown as well. I'm happy to take any questions if anybody has them at this point. I'll stop sharing my screen. Okay, so I'm not seeing any questions on the Q&A just now. I'm not sure if there's any that have come up in the chat. Let's have a look. So from Catherine, your study provides more context to the increased smoking rates during the pandemic, aside the mental stress during this time. I would say, yes, it does provide additional context. I mean, it's one of the bonuses, I think, of qualitative research, is that it enables us to dig down a little bit deeper into some of the sort of nuances around differences in smoking consumption during the pandemic. And it's, yes, you're absolutely right. The sort of mental stresses that have been highlighted previously in the literature are really important. But I think one of the key things of our study is it also shows how these changes in daily routines associated with lockdown, with changes in workplace and work routines, can actually all impact on smoking and smoking in the home as well. I can see there's a question here as well from Corne around the results are quite intuitive. Were there any surprising results? That's a really good question. I suppose, I think going into qualitative research, you always try and not preempt what you think the findings might be. But I think it was really interesting to us that it seemed to be the case that, especially with people who were working from home, it provided them with new opportunities to smoke. And I think it's surprising, given how much we know about secondhand smoke exposure in the home and the harms associated with exposure to secondhand smoke. I guess it's a bit surprising to me that in some ways all it takes in some cases is for there to suddenly be no workplace and no workplace smoking restrictions for smoking at home to increase in some cases. And that's a worry. I think that's a real worry moving forward. I can see there's a question from Louis here as well. Have your results been picked up by the industry and spun into a narrative that you didn't expect? Louis, that's a fantastic question as well. And maybe this is something that I should have a chat with you about at some point. So our findings are due to be published shortly, so they haven't been picked up on yet. But yeah, Louis, I'd be really happy to chat with you about the types of spin that we might encounter and how to deal with that as well. So it will be really interesting to see how it's picked up on. It's certainly, it's relatively different data, I think. So yeah, Louis, I'll definitely be in touch with you about that. There's a question here also from Lorraine Govinda. What would be the public health solutions to this? So she's keen to learn more on how we should deal with this. Lorraine, I think that's another really good question. And I think that we run into some challenges here because it's of course easy to impose restrictions on smoking at work, but it's very difficult to try and impose restrictions on smoking at home in a private space. And I know that, you know, there are countries, Scotland included, who have introduced, for example, you know, legislation on smoking in cars, which could be considered a private space. Legislation on smoking in homes, there are many would argue goes one step too far. So in terms of solutions and public health solutions, you know, home working is going to become the new norm for a lot of people. And I think that there needs to be increased emphasis on the hazards associated with secondhand smoke in the home, both to children and to non-smokers as well. And I would like to see, I think, more support from employers as well in terms of, you know, smokers who may find themselves working at home more often, to help them, to support them to change their smoking behaviours and to quit. I think ultimately, as Professor Ayo-Yuusf was saying previously, I think there's a lot more that could be done to support smokers during the pandemic and as we emerge from it too. So that's something I'd like to see. I'm just going to check. I don't think we've got any other questions in the Q&A. So, Catherine, I'm happy to hand back to you just now for the third presentation.
Yeah, thank you very much. Thank you very much, Rachel, for that exciting presentation and eye-opening as well, because there's so many things that we, you know, took for granted. You know, people are mentally stressed, so they're smoking more, but other things you mentioned are quite very interesting. And I hope that that study would be replicated in other parts of the world. So I'd like to welcome Laurence, who will be presenting the third, who is the third speaker. He will be presenting on tobacco industry marketing and policy interference during the COVID-19 pandemic. Laurence is an investigative researcher at tobaccotactics.org, part of the Tobacco Control Research Group at the University of Bath in the UK. And they exist within the Stopping Tobacco Organizations and Products Partnership, also known as STOP. Prior to tobacco control, Louis was a research scientist in infectious diseases, microbiology, and pharmacology at Norwich Medical School. His current research interest is the tobacco industry response to COVID-19 and industry interference or industry influence in science at Tobacco Tactics. Tobacco Tactics is a website and resource that investigates the strategies and tactics the tobacco industry uses to undermine public health. Welcome, Louise, and over to you.
Hi, everyone. So thanks for joining me here, and to the University of Johannesburg and Catherine and Rachel for hosting this webinar. I'm going to be talking about tobacco industry marketing and policy interference during coronavirus pandemic. As Catherine mentioned, I'm Laurence, a researcher at Tobacco Tactics, part of the University of Bath, partner in STOP. And so a little bit about Tobacco Tactics. So our website, we investigate the strategies and tactics of the tobacco industry, and we provide an evidence-based resource for journalists, policymakers, academics, etc. In fact, there was a question earlier to Professor Ayo-Yuusf about how to communicate truth and science about tobacco to the public. And I think that's very much what we strive to do at Tobacco Tactics, to spread this knowledge and act as knowledge brokers for policymakers and media in particular. In fact, our new site launched last year, so please go have a look, tobaccotactics.org. So my main research focus has been monitoring and analysing the tobacco industry response to the pandemic. And as part of STOP, we've produced a series of 13 reports that synthesise some of the monitoring we've conducted and try and pull out some of the trends and patterns in the tobacco industry response to COVID. And a lot of the examples I'll be talking about today and the references for those are available at tobaccotactics.org/wiki/COVID-19, where all of these monitoring reports are freely available, which you can see here. So our monitoring so far has really shown that COVID has been a reputational concern for tobacco companies. So being a lung disease, tobacco companies have been under particular scrutiny, and they're also concerned that countries are going to start raising taxes, and as Rachel talked about, issues of quitting during COVID. So early on in the pandemic, in addition to that, we saw factories were forced to close in some countries for many industries, including tobacco. And Philip Morris International, for example, was concerned that there'd be a reduced consumption in low and middle income countries, where they're relying on cigarette sales, partly because of manufacturer shutdown and partly because of people quitting. So in response to these concerns, the industry has employed some familiar tactics that reduce the risk to their business. So many of you will have seen the discussions happening around the science of COVID risk in smokers and the role of nicotine. And this industry tactic of influencing the scientific debate has been talked about a lot over the past year. There's been some evidence of industry involvement in this nicotine COVID debate. But what I'm actually going to focus on today are some other familiar tactics that maybe haven't been as widely discussed. And these broadly come under the banner of marketing and lobbying. So these approaches are used to influence the narrative around tobacco products and challenge regulation that restrict industry profits and overall take advantage of the chaos of the pandemic. These activities all come under three themes I'm going to talk about. So that's product marketing, corporate social responsibility activities, and policy interference. So the first and most straightforward of these tactics is direct product marketing. So that's marketing of tobacco products, mostly next generation products, because traditional combustible cigarettes marketing is so restricted. So using the language of COVID-19 as an advertising hook has been a particular feature of this marketing. Instagram has been a key marketing space for companies like British American Tobacco. That's despite the UK Advertising Standards Authority actually banning several BAT e-cigarette adverts back in 2019. That hasn't stopped them at the moment, and BAT used the hashtag "Today I will stay home," which is obviously a play on stay-at-home messaging from public health organisations around the world. They even printed this hashtag on BAT branded face masks, which they gave to influencers in Kazakhstan who posted on Instagram. And this was then followed by hashtag "Today I will go out" over images of a Glow vape store, which is one of BAT's products. So some of these images are from an excellent paper by Ramamurthy et al. At Stanford, where they've recorded a lot of instances of online marketing during COVID. They also recorded free gifts of essential supplies that were running low as COVID hit, giving away free gifts of vape products. Here they use infamous toilet roll shortages to tempt people to buy this vape product. In this case, it actually isn't a tobacco company product. It's a sort of adjacent issue. The campaign for tobacco-free kids in the US has also been recording some interesting COVID-related product marketing by tobacco companies. So they found that Philip Morris International was promoting its Heat Not Burn IQOS product during lockdown in Bulgaria by offering free home delivery because of lockdown. And because of contactless delivery, they were waiving the need for ID validation. So that meant that age verification was no longer taking place, which meant essentially they were selling and advertising a harmful product to minors. So some of the more subtle ways that companies have marketed and exerted influence over policymakers during the pandemic has often been via corporate donations, or also known as corporate social responsibility. So the aim of harmful industries conducting socially responsible actions, known as corporate social responsibility, is to improve the image of a company or industry and gain access and influence over officials and policymakers. And there's definitely been an increase of this during the pandemic. In fact, our monitoring alone picked up over 70 instances just in the past year of tobacco companies donating to COVID relief and using those donations as marketing tools. So these include donating ventilators, protective equipment, food, money. For example, this image here is in Honduras, where BAT donated to the local police force and then held a public press conference alongside police chiefs. And tobacco companies seem to have been particularly targeting countries with high smoking rates or high industry interference for this kind of corporate social responsibility. Another example, in Greece, PMI donated ventilators to a Greek hospital, which received quite a lot of criticism in the media actually, but despite this, in 2021, PMI's CEO was then appearing alongside the Greek Prime Minister to discuss vaccination in the country, having gained access to Greek policymakers through these kinds of donations and other actions. And this is interesting because at the same time, PMI also has investments in a COVID vaccine, which is a fact that it uses to then promote its business on its own website. So the WHO has said that governments should avoid any collaboration with the tobacco industry, and doing so is in violation of the Framework Convention on Tobacco Control, of which 182 countries are party. But avoiding working with the industry is particularly hard at the moment, and Big Tobacco knows this, and they know that offering much needed supplies encourages countries to contravene the FCTC treaty. You know, and the world isn't in a position to turn down a legitimate vaccine for sure, and BAT are also invested in a vaccine, and both BNT and PMI vaccines are now in human trials. So, you know, countries are having to reckon with the fact that these profits will go back to these tobacco companies from legitimate vaccines. And nor are people in Philippines or Georgia or Nigeria or Kenya or Greece, nor are they in a position to turn down donations from tobacco companies, donations to help fight the virus. So this does put governments and tobacco control efforts in a difficult position. It's an uncomfortable irony to have a COVID vaccine that profits a tobacco company. And it's also an uncomfortable irony to have donations to hospitals, particularly when those companies use these activities to then actively promote their brand and their harmful products. So these CSR activities also relate to the final tobacco industry tactic I want to explore today, which is policy interference. So gaining access to policymakers via donations or other activities then allows companies to be more effective at lobbying to disrupt regulation that would restrict their products. So this is of particular importance for tobacco companies during COVID, because manufacturers obviously been impacted, also people may be quitting. Countries are likely to start imposing stricter public health policies, they're likely to start raising taxes to pay for the costs of the pandemic. And as we're all very aware, lockdown has limited, the amount of work and manufacture that happens. So that meant early on, in particular, in many places, lists were drawn up that said which products and services were essential to life. So in these countries where these essential lists were in place, governments were then faced with banning the sale of certain products, such as alcohol or tobacco, as South Africa knows. And if they chose not to ban them when they had these lists in place, that effectively listed tobacco as being an essential product to life. So these bans or lists were effectively short-term tobacco regulation. And the normal pattern we see is that when tobacco regulations are proposed or enacted, the tobacco industry has some standard responses, and these include saying, first of all, that regulation will be damaging, that it will be a financial burden that threatens jobs in the country, that the regulation is not based in evidence, that more research is needed, and that despite all, the regulation will lead to an increase in illicit trade and smuggling, and that despite all this, the regulation won't be effective at what it's trying to achieve anyway. So they're the sort of standard responses from the industry. And COVID-specific arguments around regulation have also included that people have a right to smoke to relieve anxiety and boredom. Again, they've really pointed out the threat of illicit trade, that there's not enough evidence of risk associated to COVID to regulate products. That's especially when talking about next generation products like vapes or IQOS. And because decision makers are under so much pressure in such a difficult situation, this additional pressure from the tobacco industry can be quite hard to bear. So this also increases the risk that countries then collaborate with the tobacco industry, as we also saw with CSR activities. So this is why we saw lobbying in places like Brazil and Russia after tobacco manufacture was closed down back in April 2020, and also lobbying in Bangladesh to get cigarettes put on the essential goods list. So that was successful lobbying. And there were also requests to delay the ban on menthol cigarettes in the EU because of COVID. That was not successful lobbying, because that ban did go ahead. So I'm going to dig a bit further into some of these examples to see how this industry lobbying works and explore the arguments and see what impacts policy interference has on health outcomes. So the first example is Pakistan, which prior to the pandemic, Tobacco Atlas estimated that 17% of deaths in the country could be attributed to tobacco, which is very high. The government has struggled to control the tobacco trade, and both Philip Morris and British American Tobacco have failed to report their genuine cigarette production figures. And they also have a proven hand in black market trade in the country. So partly thanks to these issues, the healthcare system there is ranked 154th out of 195, according to the Lancet. And therefore hospitals have been under great strain during COVID. Philip Morris have also reported questionable black market trade figures there of 44%, which is a very high amount of black market trade, which is why it's a slightly suspicious number. And then so when manufacture was shut down and tobacco sales were restricted in Pakistan during lockdown, PMI used these questionable illicit trade figures to then successfully lobby to reopen their factories, saying that it would boost illicit trade too much. So similarly in Brazil, the local government there decreed a ban on non-essential industrial manufacture, and Philip Morris pushed to continue cigarette production despite this ban, because they wanted to avoid compromising the business and putting workers at risk. Which is ironic given the fact that workers are at greater risk of being in a factory, and we saw outbreaks of COVID-19 in a number of tobacco factories, including quite a well-reported one in Indonesia where several workers died. And then finally, of course, here in South Africa, where people are well aware of the tobacco and alcohol ban, which resulted in the Fair Trade Independent Tobacco Association and British American Tobacco South Africa taking the government to court over this ban. I know obviously this is a thorny issue here, and there are others on the webinar far better qualified to discuss it than I am. But whichever way you see the ban as a matter of policy, it is still, I think, a good example of a tobacco company influencing government policy relating to COVID by legal means in this case. And illicit trade increased, and this fact was used to argue against the ban by BAT. But it's also worth noting that BAT has been under a lot of suspicion for their involvement in illicit trade and smuggling in Africa, including South Africa. Again, something others are probably better placed to discuss than I in more detail. So I think these are just a few examples of how the industry interferes in government policy and markets their products. It's all a kind of combined system of interference, CSR, marketing, and I think it's important to cultivate a global view on these tactics. So as I said, the combined industry tactics of marketing, CSR, and access to officials and lobbying is there to protect manufacture and prevent regulation. And it all has one larger aim, which is to protect profits at a time when the industry is particularly vulnerable. Not only to protect profits, but also to use COVID potentially as a springboard to renormalize the tobacco industry, make it look more like pharmaceutical companies and make it appear part of the kind of public health solution. So I think that's why it's so important to monitor this stuff on a global scale and draw out these themes of tobacco industry behavior so it can be challenged. So this monitoring and challenging of the industry is what we've been trying to do at Tobacco Tactics and at the Tobacco Control Research Group in Bath and in STOP. And in fact, in June, we're going to be relaunching our COVID-19 Tobacco Tactics Resource Centre, which is available at the address here. So at the moment, it currently hosts all of the COVID-19 monitoring reports that I mentioned, as well as our analysis of the industry during COVID. But next month, it's also going to have some large updates and will feature a new animation, which is a still of here, discussing the issues of tobacco company COVID donations. So this is intended for a wide public audience and for sharing on social media. Actually, some of the images from the animation have been featured in previous slides. The COVID page will also host our new database. There's a little screenshot of that there, which will have all of our monitoring data covering tobacco company activities during COVID, and it will be available in a free, easily searchable form. So this will have all the examples I've spoken about today, plus many, many more with references and kind of searchable lists. Yeah, so please come take a look and make use of the resources if it's of interest. And I think that's it. Thanks you all for listening. Thanks, Catherine and Rachel and Johannesburg for hosting, and look forward to some questions.
Thank you so much, Louis. That was absolutely fascinating. I can see that we're running a little bit behind time at the moment by about 15 minutes. So I think what we'll propose to do is we do have some questions here for you. But in the interest of time, we'll leave them to the discussion section at the end, Louis, and then we'll move straight on to the next presentation just for now.
Yeah, absolutely. That sounds good.
Thank you. So Catherine, would you like to introduce the next speaker, please?
Yes, thank you very much, Rachel. The next speaker is Professor Corne van Walbeek. He will be presenting on how the title of his presentation is "How has COVID-19 affected the sale and consumption of tobacco products? Lessons from South Africa." Professor Corne van Walbeek is a professor in economics at the University of Cape Town, and the executive director of the research unit in economics of excisable products, REAP. Between 2009 and 2012, he was the director of the School of Economics at UCT. He has more than 20 years experience in the economics of tobacco control, having authored or co-authored more than 30 papers on various aspects, including the demand for tobacco, industry price responses, changes in smoking prevalence, the size of the illicit market, and modeling the public health and fiscal impact of tobacco tax changes. He was the founder of the Economics of Tobacco Control project in 2011, which developed into REAP in 2019. Since 2012, he has developed a research interest in the economics of alcohol policy and sugar-sweetened beverages, and has published a number of reports and papers in this area. Since 2011, Corne was the PI or co-PI on more than 10 grants, including the Bill and Melinda Gates Foundation, the African Capacity Building Foundation, the IDRC, and Cancer Research UK. We welcome Corne van Walbeek as he presents to us. Thank you very much.
Thank you very much, Catherine. Can I just confirm, are you seeing my screen at the moment?
Yes, I am.
Excellent. Well, thanks very much for that very elaborate and very generous introduction. So I am delighted to be able to speak to you this afternoon. And I will be talking a little bit about some of the work that we've done last year, specifically focusing on the tobacco sales ban that we had in South Africa. And I'll be focusing more on the quitting aspects, but of course there are other aspects as well that I would like to talk about this afternoon. So just for those of you who are not from South Africa's pattern and response to the pandemic was pretty similar to most other countries. So on the 15th of March, President Ramaphosa declares a national state of disaster. We went into lockdown on the 25th of March, and it was a very strict lockdown at that point in time. Initially, it was aimed to be for 3 weeks. It subsequently became 5 weeks, and then over time, the restrictions were being relaxed. And at that point in time, the sale of all non-essential products were banned, including those of tobacco. And in fact, the list of non-essential products was very long, and people could literally just buy the necessities of life at that point in time. So after 4 weeks, the president announced that there would be a relaxation of the lockdown starting from the 1st of May. And he also at that point in time announced that there would be a lifting on the ban on tobacco sales. And that decision was subsequently overturned. It caused a little bit of a ruffled feathers within the cabinet and within the National Coronavirus Command Council. But the government stuck to its guns, and for an extended period of time, the sales ban was in place. And only when the country went to so-called level 2 in August of 2020 was the ban on tobacco sales finally lifted. In the meanwhile, we had a whole lot of things that I have not recorded on the slides. We had the 2 court cases. The first one was with the Fair Trade Independent Tobacco Association taking the minister to court. The second one was British American Tobacco taking the government to court. That was at the beginning of August. And within this context, there was a lot of activity in the media, lots of comments, a lot of anger, to be completely fair, among smokers. There was significant support for the ban from especially the pro-health community. And it was all in all a very tumultuous period. So just to explain where many of the things that I'll be talking about later on come from. So I, as Catherine has indicated, I'm the director of REAP. We conducted a number of online surveys during this time period. The first one was at the end of May to the beginning of, rather the end of April to the beginning of May. We had about 12,600 respondents. We did another very large survey in June. And in September, October, we did a smaller one that was focusing on post the lifting of the ban activities of smokers who had previously answered some of our questions. Because it was focused on smoking and quitting, we asked very substantially detailed questions about people's behavior during this time period. But it's very important to point out this was not a nationally representative sample. We significantly oversampled the rich end of the population, primarily whites, and also females, and the poorer section of society was significantly underrepresented because it was an online survey. We subsequently had the opportunity to put in a few questions, and sadly only a few questions, into another more representative study called the National Income Dynamics Study, and it was the Coronavirus Rapid Response Mobile survey that was conducted in November and December. And sorry, the N didn't appear there, but there were about 5,000 people altogether in the sample, of which approximately 700 were smokers. So we're looking at a substantially smaller sample, but nevertheless, the important thing is that the sample was roughly nationally representative of the adult population. We subsequently married the 2 sets of samples, the REAP sample and the NITS-CRAM sample, and surprisingly, the conclusions were
roughly similar. In some instances, they were slightly different, but generally speaking, one could see that we're looking at roughly the same population. So if we have a look at the positives of the tobacco sales ban, it's rather unsurprising that if you ban the sale of smoking, that some people will be incentivized to quit. And when we saw in our NIDS cram sample, approximately 8% of respondents in November, December indicated that they had quit during the lockdown. 85% indicated that they continued smoking, and 7% did not respond to the question. So if we take a generous view of those 7% and say, let's assume that they also quit during this period, then between 8% and 15 or 16% of our smokers in South Africa actually quit, at least temporarily, during this period. And if one looks at it in absolute terms, that is between 750,000 and 1.5 million quitters. From a public health perspective, that is a big win, and I think that is something that we would like to celebrate and we want to emphasize as well. If we have a look at how did people firstly attempt to quit and to what extent were they successful in quitting, these were the results that we got in June of 2020. So this is not nationally representative, I want to emphasize that, but the numbers look very similar to the numbers that we got from the nationally representative sample in November. And what we see is that 27% of people attempted to quit. Approximately a third of those people who attempted to quit were successful at quitting, which indicates that by June 2020, approximately 9% of the respondents to our survey were successful in quitting. We see that there's a significant difference in terms of gender, where males were typically more amenable to try to quit, more successful at quitting, and so on. Of the people that had successfully quit, approximately 70% indicated that they wanted to remain quit after the sales ban was lifted. I will get to it later, but by June, the prices were 250% higher than what they were in the pre-ban period. This was the height of the sales ban, and the market was very, very disrupted at this point in time. Cigarettes were relatively freely available, but they were very, very expensive. So we also asked people, when did you quit? And you will notice there from the dates, they are in 2-week slots. And basically what we see is that people tend to quit relatively quickly, or tended to quit relatively quickly in at the start of the lockdown. And as the lockdown wore on, the effect became less and less pronounced. And we see that towards the end, a relatively small proportion of people that, a small proportion people quit during that time period. So we asked ourselves a question, and this was also mentioned by Lekan in his presentation: why did you quit? And by far, the large majority indicated that cigarettes had become too expensive. More than half of people who wanted to quit indicated that that was the reason for it. 14% of people said that they could not find cigarettes. 11% indicated that the ban motivated them to quit, sort of a social desire to obey government orders. 8% quit because of health concerns, and about 10% had other reasons for quitting. Again, we see some differences between genders, but not huge differences between them. What we also asked is, how many cigarettes did you smoke before the lockdown, and how many cigarettes are you smoking during the lockdown if you continued smoking? So people who quit smoking during the lockdown typically were lighter smokers in comparison to those people who continued smoking during the lockdown. In fact, the people who were able to quit smoked on average about 8 cigarettes a day compared to 16 cigarettes a day by people who continued smoking during the lockdown. Also, the continuing smokers on average reduced their consumption by approximately 20%. And this is to some extent in contradiction to what I forgot your first name, Miss O'Donnell, Professor O'Donnell indicated to us that in the UK, many people actually smoke more. In the case of South Africa, we find that generally speaking, people cut back on their consumption for obvious reasons, and that is the cigarettes became so very expensive during this time period. So if we have a look at the longer term effects of the sales ban, I've indicated to you previously that in the June survey, 70% of quitters indicated that they would remain abstinent after the sales ban was lifted. When we looked at the nationally representative survey in November and December of 2020, at that point in time, depending on how you define your denominator, between 1.25% of successful quitters during the lockdown had started smoking again. So one gets the impression that even though people wanted to remain quit, the desire to start smoking again and the addictiveness of nicotine clearly took their toll and caused people to relapse. So let's have a look for the last few minutes that I want to talk about the negative aspects of the tobacco sales ban. It's been mentioned a number of times, and that is that the illicit trade in South Africa had become very, very problematic. It already was problematic before the time, but the sales ban really emphasized and exacerbated the problem that we were already experiencing. So on this graph, I indicate to you between 2002 and 2017, my colleagues' estimates of the illicit trade based on a so-called gap analysis. And what you would notice is that between more or less the turn of the century and 2009, the illicit market was roughly under control. It was up possibly as high as 10%, but probably not as high as that even. And anything between sort of in the low teens, or rather in the low single-digit numbers. Then from 2010 onwards, what we see is that there's been a pretty gradual but even sharp increase in the illicit trade, especially after 2015. And the main reason for that is not excise tax increases. In fact, before 2010, the excise tax increased by an average of about 10% per year from the early 1990s through to 2010. Very rapid increases during that time period, not associated with an increase in illicit trade. From 2010 onwards through to 2019, the excise tax increased by about 1 to 2% per year in excess of the inflation rate. In other words, excise tax increases are not correlated with this very rapid increase in illicit trade. The main reason for the increase in illicit trade was an effective breakdown of our tax authority under what South Africans now know as state capture, what non-South Africans would probably regard as corruption at the very, very highest level that was permeated right throughout all government institutions, including the South African Revenue Services. And that sadly resulted in the tobacco playing field becoming a free-for-all, and where presumably paying the excise taxes became a very optional and voluntary type of experience. And that resulted in this very rapid increase in illicit trade, especially from 2015 onwards. What's not shown on this diagram in 2018 and 2019, it seems as though there's been a slight reduction in illicit trade. We estimate that by 2019, the illicit market had fallen to between 25 and 30% of the total market, whereas it was about 35% in 2017. So clearly what happened was we had a sales ban. We already have a very well-entrenched illicit market, and the tobacco market clearly did not disappear during the sales ban. It was driven further underground, and it was becoming more and more entrenched. So based on our nationally representative survey, we were able to estimate that the total market shrank by 30% during the sales ban. And of course, all of those cigarettes that were being sold were illicit. What we also saw, and I will show you the diagram on the next slide, is that the prices of cigarettes greatly increased during the sales ban, up to 250% more than pre-ban levels. The main mechanism that producers used to get the cigarettes into the market was a concession that was made to them at the end of April 2020, where the government said, you may produce cigarettes, you simply can't sell them within South Africa, but you can export them. And I haven't got the diagrams to illustrate this to you, but what we suddenly see is huge increases in exports to our neighboring countries, specifically to Namibia, to Lesotho, and to Zimbabwe. These countries traditionally received some South African cigarettes in the past. Suddenly, the exports to these countries have increased by sometimes a factor of 10, and very much there was an oversupply of cigarettes in these markets. What was also surprising is people in these countries indicated that they actually didn't see the South African cigarettes. So the best explanation that we can give to this is, even though officially these cigarettes were exported, most of them actually never left the shores of South Africa. They were simply diverted into the local market to a very, very desperate group of smokers paying exceedingly high prices for all these products. What we also saw is that the market shifted away from the multinationals, more towards the local producers. These local producers, despite their protestations, have been found to be disproportionately involved in the selling of very cheap cigarettes, which are so low, and the prices are so low, that it's impossible that the tax has been paid. So that part of the market has become bigger. That doesn't mean to say that the multinationals are angels. I'm not suggesting that for half a minute. But the local manufacturers have a reputation, and we've got evidence for it, to suggest that they are much more involved, or more brazenly involved, in the illicit market. So just this figure over here, the horizontal line on the diagram indicates what was the price before the lockdown. The horizontal axis indicates to you the days into the lockdown. So our first survey was around about 6 to 7 weeks into the lockdown, and we see that the prices were more or less double than what they were before lockdown. Then when we did our second survey in June, we saw that the prices were in the order of 250% higher than the lockdown. And when we did another survey after the lockdown, or rather after the sales ban was finished, we saw that prices were slightly higher than what they were before the lockdown, but not significantly so. In terms of the division of the South African cigarette market, before the ban, we see that the multinational corporations had approximately a 3/4 market share. The local companies had about a quarter of the market. We see that as the lockdown dragged on, the market share of the non-multinationals became much bigger, and eventually they ended up with more than 3/4 of the market by June. After the ban, things went back to roughly normal, except that the multinationals had lost a very significant market share relative to the pre-ban period, even though they clawed back some of their cigarettes during that they had lost during the market, rather that they had lost during the sales ban. So in conclusion, at the beginning, when the lockdown was implemented, there was a lot of uncertainty. People didn't know it was a respiratory virus, and it made sense to implement a ban on the sale of cigarettes in order to protect health and to defend the public health system. Our argument, right from the very first report that we put out, is that the extension of the ban beyond that initial 5-week period was probably not justified. And the reason that we had for that is that the public health benefits, in other words, the number of smokers quitting, was decreasing over time, as I've indicated to you. But the costs were basically increasing over time. There were two main costs. The first one is the short-term cost of a loss of government revenue. That was in the order of about 35 million rand, or $2.5 million a day. But more importantly, the long-term loss is that the illicit market became more entrenched over this time period. We argued very strongly in our second report, as well as our third report, that a much more effective approach would have been to substantially raise the excise tax right at the outset. It's greatly discourages people from smoking. At the same time, it's also important to put measures in place to reduce illicit trade. But even if you were to increase the tax by 50, 100, even 200%, your illicit market would never be as high as what it would have been under a sales ban, because under the sales ban, the market had become the illicit market had become 100% of the total market. The semi-good news is that in February 2021, our Minister of Finance increased the tax by 8%, significantly more than I think most people had predicted, and certainly what the tobacco industry would have feared. But I would have argued that a 30, 40 or 50% increase in the excise tax would have been a much better approach. So it's a half egg, it's a half situation. It's better than nothing, but much more could have been done over there. So with that, I'm going to give it back to Catherine. Thank you, Catherine, for the opportunity to be able to speak to the group, and thank you very much for listening.
Thank you,
Thank you very much, Rachel.
Thank you very much. Another absolutely fascinating presentation. I'm sure everyone will agree. I'm conscious of time. I think we should have a poll popping up on your screen shortly, which is just for you to give us feedback before people log off at the end of this session. You should see that shortly. I would like to give the opportunity for one very quick question to both Louis and Professor van Walbeek, given the time constraints that we have. So I don't know if we can very quickly, we have a question for Louis here from Catherine, which was that tobacco companies are all supposed to contribute their fair share towards the upliftment of the society where they do business. Would you agree with this? And if yes, how should they do this ethically, given they're known to use such opportunities to promote their products? And Louis, I know that's a couple of questions in one, but if I can urge you to give a brief response so that we've got time to go back to Professor van Walbeek for his question, that would be ideal. Thank you.
Great, yeah, it's a good question and a difficult one. I think, yeah, as we talked about, often they use these opportunities to promote themselves. And I think what's key is basically having a kind of barrier between the expectation of companies to, like you say, contribute to society. That's different to them doing kind of direct marketing donations. So I think when you want tobacco companies to contribute, then you need a clear system of taxation or taking that money somehow, and then a real independence of those bodies actually using that money to contribute to society. I think it's also risky talking about the idea of tobacco companies even contributing to society as a kind of responsibility, as if it's, you know, they're a kind of legitimate party in society. I think the whole idea is that we're saying they should be illegitimate in that they cause massive harm and destruction, and so to treat them in a kind of as we would other legitimate stakeholders in our societies, I think is risky too.
Thank you, Louis, much appreciated. I'm just trying to find a question here. As a question from, and apologies if I don't pronounce your name correctly, Zakia Ibrahim for Corne. Will the survey respondents be followed up in a longitudinal study so that there's an indication of whether they remained abstinent from smoking months later?
Yeah, thanks very much, Zakia. That's a great question. So our third survey was in fact a panel study. In terms of our second survey that we conducted in June, we had something like 23,600 valid responses. We subsequently went back to all of them because we asked them, may we contact you again? And something like 9% of people said that we could. And we went back to all those people. And in the third survey, we actually only surveyed those that had taken part in the second survey. So it was a panel study from that point of view. But as you can see, we already had a huge amount of attrition at that point in time. We have the information of them. It might be worthwhile for us to go back to them. At the moment, there's just too many other things happening, so we haven't actually done that. But it certainly is an option. We haven't actively pursued it though at this moment in time.
Thank you. I have one other quick question for you, Corne, from Catherine, who says, do you think that the South African government would have been able to justify increasing taxes on only tobacco products during the COVID-19 pandemic as a public health measure?
Yeah, that's a good political economy type question. And I don't know. I think it would have been pretty tough to do it like that. But at the same time, most countries have not implemented a sales ban on tobacco, and South Africa did. So you are sitting between two very difficult type of situations. On the one hand, increasing the excise tax by 50% or whatever, and on the other hand, banning the sale of cigarettes. From a sustainability point of view, increasing the excise tax would have been much more sustainable, because what you do is you permanently increase the excise tax, it permanently increases the price, and we know from the economics literature that people respond to price changes very dramatically. What we find is, and I'm slightly deviating from the question, but what we find is that most of the people who continued smoking during the sales ban period saw it as a temporary blip. Everybody knew right from the start that this was not going to last forever, and I think that it went on for 20 weeks was a surprise to many people. So people just said, well, let me just grin and bear it, and I'm not ready to quit, but hopefully the sales ban will go over and then life will continue as normal. If you permanently increase the excise tax, you have a much more permanent effect over there. Your question is a good one, and I haven't actually discussed this with people at Treasury, but I think in retrospect, if we had to do it again, I think they would look at this more, what's the right word, more sympathetically than imposing a tobacco sales ban in the way that we had.
Thank you, Corne. That's a great answer. Catherine, I'm going to come back to you now to close the session.
Thanks very much, Rachel. Thanks to all the speakers. Excellent discussion, excellent presentations. I'm sure that people are excited to have joined us. I just want to ask Neo or Palesa if they have anything to say concerning forthcoming webinars from ICARA.
Thank you very much, Catherine. I wonder whether you're able to see me?
Yes, we can see you.
So yes, indeed. Thank you very much. So we are going to be having more webinars in the future. And so we hope that you'll be able to attend those future webinars. So we have one coming up looking at cannabis markets. We're going to be having one coming up in August, hopefully looking at alcohol and COVID. So that should be also interesting. And then we have a third one focusing on the Caribbean and Latin American states. So we should be having those coming up. Please look out for them on the ICARA website, ICARA.info. Thank you very much. Back to you, Catherine.
So thank you very much. Thanks, Neo and the ICARA team and the UJ team for joining us to, for inviting us to organize this webinar. I thank Protect Our Next campaign, which is the campaign responsible for pushing for the tobacco bill to be passed in South Africa. They've also provided technical support to us. I thank my colleagues in the MRC and everyone for attending. Thank you for your time. It's been a long day, and we wish you a very restful evening. Thank you.
The University of Johannesburg, the future reimagined.